welcome to Untold Physio Stories podcast, your perfect commute resource with physio failures, successes, interesting cases, and more from the physio and rehab world, with your hosts, Drs. Andrew Rothschild and Urson Religioso. Untold Physio Stories is now sponsored by MyPT Insurance. Insurance just got easier. Through continued research, MyPT Insurance has crafted a policy that is economical and provides you with the peace of mind you need. Your extensive education, training, and experience as a PT allows you to assist clients in achieving their personal health goals. By practicing without individual professional liability insurance, you could be placing your career and future finances at risk. Whether you're a student, self-employed, or employed with a company, MyPT Insurance is here to provide affordable insurance coverage while protecting you and your patients. MyPT Insurance's plan also includes mobile coverage, which means it follows you wherever you work in the United States. Employed rates and self-employed rates are available. Visit myptinsurance.com/edge to sign up today. Welcome back to Untold Physio Stories. I'm one of your hosts, Dr. E, with Modern Manual Therapy, Edge Mobility System, and live Modern Manual Therapy seminars are back this year. So make sure to check out modmt.com/calendar. And my co-host is
Dr. Andrew Rothschild with Modern Patient Education.
All right, Andrew and I are back together again after an extended hiatus. I recorded a couple guest episodes as Andrew and I weren't able to get together, but I know he has an interesting case for me today, right?
I do. I hope so, at least.
Right, we'll see.
Yeah. I think you and I are kind of similar in our assessment of the prevalence of SI joint pain in people who present with low back pain.
Right, as in we don't really believe in it? Not very often?
Yeah. Even though the literature will say sometimes I've seen between like 13 and 18%, but even to me, that just seems very high. And
I would say it's very high.
What's that?
I think it's high when they say it's 10%.
Yeah. And so, and I can't tell if, like, from anecdotal, from 16 years of practice, is it because of my bias against it? But especially based on, obviously the more recent research, it's like I say recent, but it's been around for over 10 years at least, by Laslett et al. And a couple other authors looking at the, pain provocation studies, especially when used after repeated movement testing of the lumbar spine to increase sort of the reliability and validity, rather than the old sort of movement palpation assessment test, which a lot of us were taught back in school, and hopefully that is being weaned out of school. But
I hope.
What's that?
I said I hope.
Yeah, exactly. But I had a patient, I guess I've been seeing him for about 3+ weeks now, and 14-year-old male, athlete, basketball player, baseball player, also just quite small for his age. He looks like he could be 10 or 11. I keep forgetting that he's 14. But he had been in basketball. He had been one of those ones where you try to attempt taking a charge like twice in a row, and he's usually like the smallest guy out on the floor. And so he got ran over twice, basically, landing on his right posterior hip, buttock area, essentially, both times. So he came in. I don't remember if he had a diagnosis when he came in from the physician, but he had pain in sort of the posterior right hip, nothing in the back, kind of a little bit in the lateral thigh, and I didn't really even. My first assessment was, back or hip pain, so maybe a little blunt force trauma, soft tissue. But after really kind of going through normal assessment and everything else kind of coming out, lumbar flexion, extension, side bending, repeated movements, really, no non-provocative, hip range of motion, was, pretty much full in terms of passive movement. Resisted motion was good. In the things that were, he could not run, he couldn't, jumping, landing, squatting. These were the things that really started to bother him. And I have a DPT student right now from South University, so we were kind of doing sort of a co-evaluation. And for whatever reason, I was like, you know what? I think we got to do some SI joint tests. It's like, it's just for whatever, he kind of had that, the Fortin finger sign, like pointing to the exact area location of the SI joint, just distal to the PSIS where his main area of pain was.
Is that a test? I don't even I don't even know what that is. I've never heard of that, but
Yeah, there's a test called the Fortin finger test, and it's basically they point to the area of pain, and it's just about a few centimeters inferior and lateral to the PSIS, and that's like the area of the SI joint. It's supposed to be, just by itself. Some of the research as like a specific test for SI joint pain, but it's
so
never.
the patient can reliably locate it better than a clinician can.
Yeah, it's not. It's not. It's one of those tests. It's like you can't take it for that one single test and one single study. But that was just one piece of information.
Yes.
But then, so I did all the tests, and he had a positive thigh thrust test, he had a positive Faber test, he had a positive sacral thrust test, and he had a positive Ganslin test. The only two tests that were negative were SI joint compression distraction, and those were the only tests that reproduced his exact symptoms. And so he had a mechanism of landing on one side of his like butt essentially, twice in the same game, and nothing else provoked his symptoms. Spine motion was full and painless, and I got an SI joint belt. We had some still back in like the supply closet, and it's like squatting would produce his pain. I had a couple sort of asterisk signs. And I put the belt on him, and squatting wasn't painful, and I can't remember what else I'd done with it, but I did something like another movement that had been painful, and all of a sudden was less painful. I was like, I think I have an actual diagnosis of true SI joint pain in a 14-year-old male, clearly not postpartum.
Right.
From
not,
a trauma.
Not a postpartum 20-something or 30-something-year-old hypermobile female.
Exactly.
Yeah.
I was like, this is just bizarre, but
well, we think it's bizarre. Some other clinicians exactly. I see that every day.
Yeah, exactly. And then and he's been doing. We've been treating him like he's been doing great just over the past few weeks, and he's it was that's the other thing too. He was very tender. It wasn't even like a little bit in sort of the gluteals, that area, but really sort of like in that area where you would, posterior longitudinal ligament of the SI joint, like that kind of area deep in there was just very just generalized achy tender. So yeah, it's like, probably my first case of true SI joint pain in I don't know how many years.
Yeah. I mean, I think I saw one 2 years ago that it actually podcasted about too, that I tried like also repeated motions, and it was a PT, and it was during lockdown. So it was virtual. I don't know if you remember this, but basically, even though the pain went below the knee and she only had it lying in bed and not in weight bearing, the only thing that made it better was in bed after all the day stuff was better. Because repeated motions made it better during the day when she was up and around and everything. But the only thing that made it better at night was wearing an SI belt at night. Yeah.
That's
So that was
wild.
probably my last one. And that was actually atypical. Yours is actually very typical other than the demographics.
Right. They had like the trauma, that mechanism for sure.
Yeah.
But yeah, just the age, the gender.
Right.
You think more, more often than not, probably maybe more just hip back related type thing from that kind of, but yeah, just, maybe the age still growing, still going through puberty, those kinds of things played a role. But the good news is he's doing great. It's just one of those ones I was like, wow, I really think this is what it is.
All right. Well, that is I mean, I think that's interesting, but I don't know if other people will. I think people who
I
follow
thought it
us
was
a
interesting,
lot,
but I think just especially with my sort of yours and my's
our
extreme
bias.
bias away from it, still keeping it. I'm glad that I didn't let it overly cloud my my evaluation to ignore just checking it.
Yeah, for sure. I mean, according to Laslet's research, you have a pretty high probability that it's true SI.
Yes.
With the I know the revised version was not 7 tests. It's only 5 tests now, right?
Yeah.
It's not
Like I think
yeah.
Lassa didn't have the Faber test, but another study had the Faber test. That was like the main difference in terms of like SI joint compression, distraction, thigh
Yeah,
thrust, sacral thrust, and Ganslins. And then one other study had Faber test in there.
right.
But
Yeah, I
you
wonder if there
basically
are
had
studies.
four, had one, two, three, four, positive tests there.
Yeah, yeah, in the presence of absence of change with repeated motions. But yeah,
Yeah.
I wonder if there's any other studies that ever further looked at which tests were more likely to be positive. Because like you, I find that the SI compression distraction doesn't reproduce it as much as the
Very
other ones.
rarely, yes.
Yeah,
I
yeah.
know
And I
the
just
thigh
think,
thrust test is supposed to be very sensitive,
yeah,
so, but not
yeah.
necessarily specific. But
And I've also seen different ways to do the SI compression distraction, some in side lying,
yeah,
some in supine. And I just wonder also if the variance in the way it's performed, I'm like, how much is it really distracting or compressing?
right,
You know?
right, yeah. It's truly such a stable joint. How much is it actually changing? As much as, I guess depending on the sensitivity or the degree of, if there is a true like ligamentous strain type issue, is it
Mhm.
truly put enough stress on it?
Yeah,
And I
yeah,
think
because
of
I'm
like
especially with like
Janssen test.
the posterior distraction where you're trying to basically squeeze the anterior ilium. I'm like, how much am I really stretching all these like super fibrous ligaments? It seems like a rotational component would be needed or some sort of thrust,
Right,
like a shear, some sort of shear or a thrust would be needed rather than
right.
literally taking the ligaments along their strongest tensile
Yes.
direction
Which
and trying to stretch them. It doesn't seem like that one. It seems like that one, I bet, would be the least likely to be positive.
Yeah, which makes sense. I've very rarely ever. I'm trying to think back in my career, like ever those have been positive at any point, other than just like tender where you're poking on it. But
Right. Or someone's like, why are you squeezing my bones there?
right,
Yeah. All right, Andrew, where can people find you?
people can find me on Instagram and Twitter at a Rothschild PT, and of course, Modern Rehab Mastery and Modern Patient Education.
All right. And we have just launched another cohort of Modern Rehab Mastery. MMT is starting this month, April 2022. So you can join anytime. But overall, our cohort will come back around in about 4 months. And either Andrew or Kyle will be taking MPE or MST next. So definitely remember to rate Untold Physio Stories 5 stars wherever you listen to podcasts. And if you have an interesting story or big physio failure, definitely reach out to either Andrew or myself and get on the podcast. Well, you can find me, Dr. E, at Modern Rehab Mastery. That's our new online mentoring program. It includes modern manual therapy, modern patient education, and modern strength training. It's 3 months with 3 mentors, so 1 month with each mentor, 4 weeks, tons of modules, lots of CEUs, learn at your own pace for a month, then move on. So go beyond the seminar. You also get chat room with your mentees and mentors and live Q&As every week. Check out all my products, Edge Mobility System. We have the new Edge ISTM toolbox that includes the Edge Mobility Star and the OG Edge Mobility tool, our Edge Restriction System BFR cuffs. That's part of Dr. Kyle Coffey's Modern Strength Training BFR certificate. I hope to see you at a live eclectic approach course soon. That's Modern Manual Therapy in US, Canada, and South America. And make sure to rate Untold Physio Stories 5 stars on Apple Podcasts. You could also subscribe on Google Podcasts, Stitcher, and Spotify. And as always, you guys have an awesome day.